Doctors, what is your worst case of I Googled my symptoms? A few years ago, I had very intense Krav Maga training on a weekend, overnight from Friday afternoon to Saturday afternoon. Naturally, I was done for until later on Sunday. On Sunday evening, I noticed that I was peeing brown. At that point, I attributed that to the meatball marinara combat ration I had, and I didn't think much about it. On Tuesday, I started to get worried and started Googling. As a scientist myself, of course, I did not go to mama forums and that sort of stuff, but rather PubMed and sorts, and I also eventually found things like slides from medical training lectures. Within half an hour or so, I came to the conclusion that I might have rhabdomyolysis. So I printed 2 papers about it to read on the way, left work, and got on a train to my GP. I arrived there, told him what was happening after intense and prolonged physical stress, and suggested considering rhabdomyolysis. He took a urine test and told me I had hemoglobin in my urine and that I probably had a bladder infection and should take antibiotics. I told him that his test strips would also test positive for myoglobin, and this was in line with rhabdomyolysis. He conferred with some lab doctors for 10 minutes, came back, agreed, and sent me off to the hospital for lab work. In the hospital, they took a sample for creatinine and wanted to wait for the results, but I insisted on also testing CK. This would have been around 7 p.m. Then they sent me home. Later that evening, I got the results. Creatinine normal, CK over 20.000. How much over 20.000? Don't know. We stopped diluting at that point. Drink a lot and see your GP in 2 days for another sample. Now, I don't know why, but I remember that I called the hospital again the next day, only to be told that I should come in immediately for forced diuresis. They were just about to call me after having covered the topic in the morning meeting. So I turned around, got there, was admitted, and was sent to a room with a drip of saline solution. No further instructions, no further examination, except for another sample. I got myself a few bottles of water, took action to get another drip when the first one was done, and repeatedly demanded to see a doctor. The second drip did not run well, but nobody seemed keen on doing a lot about it, so I kept drinking and demanding a doctor. When in the evening I was told I would see a doctor in the morning, I had it and said I was discharging myself, which let them get some young assistant doctor to tell me, your CK is over 2,000 and you should stay here for treatment, to which I countered, it is over 20,000 and you're not treating me, bye. Now, this is where the story gets wild, and if you don't believe me, that's fine, but I have the lab reports lying around here somewhere. So I discharged myself and kept drinking. Now, the next day was the start of a long weekend due to a bank holiday, so I went to the emergency walk-in GP clinic and told them my story. They said that it sounded like I should be in the hospital, but apparently I had things under control. They took a sample and gave it to me along with a prescription for a lab report. I don't remember if they maybe thought I was an MD myself or if a physicist who seemed to know what he was talking about was enough for them. With that, for the first time, I got the absolute CK value, which still was, as far as I remember, 18,000. So for the next few days over the long weekend, I drank 12 liters of water per day, monitored CK and electrolytes with the daily lab tests, and kept my urine pH in the slightly alkaline range with sodium bicarbonate and test strips to decrease the nephrotoxicity of myoglobin, something that nobody even tested to that point. On Monday, I checked back with my GP, who, in the meantime, had talked to an acquaintance of his who was a military doctor then and kind of backed my treatment, to the point where a doctor can actually back such self-treatment. On Tuesday, my CK was well below 2,000, which seems to be the worst is over limit in the military. I kept drinking a lot and monitoring the pH for another few days, and then I went on with my life. That was 5 years ago, and I haven't noticed any consequences. That said, by no means do I suggest that Googling makes you smarter than your doctor. But medicine is a huge and always changing field that nobody can fully cover, even within the boundaries of his field, and at least if you have a scientific education, it is very well possible to find valid angles on something that your doctor did not think of. I know that there are huge numbers of patients that ask for even more ridiculous stuff, but it is still worth checking if that person might have a point. It might save his kidney. Story 2. When I was in high school, I had a violent and persistent cough that would not go away. I wasn't really feeling very sick, but the coughing was disrupting my life. I could hardly eat because if I coughed after eating, I would just spew up what was left in my stomach. I couldn't drive because my stepdad had the same thing and he coughed so hard that he blacked out while driving. and ended up in a wreck, which netted him a DUI because the police blamed it on the non-drowsy cough medicine he was taking. I have pain all over my chest and back from coughing, not being able to sleep, isolation at school because no one wanted to be near the coughing girl and get sick too. Multiple trips to the doctor did not result in a diagnosis. The doctor prescribed me all the Notus cough syrup, the coating kind that Justin Bieber drinks for fun, I think, that she could legally prescribe me because it's a narcotic. I started looking up all my symptoms and whooping cough was a lock. I printed out all my reputable sources and showed them to my doctor, and she shot me down. But you've had whooping cough vaccine when you were a baby. You can't get it. Never mind the fact that vaccines aren't always 100%. I pointed out the source that said that the whooping cough vaccine may only last for so many years. This was in the early 2000s, so updates were to come. She still didn't believe me. She sent me to a specialist. The specialist decided that maybe if he squinted and tilted his head the right way as he looked at my chart, maybe the coughing had something to do with the mild case of asthma that I had been diagnosed with 8 years before that hadn't bothered me since. I'm pretty sure it was breathing difficulties related to a long-term case of fat rather than bronchial inflammation. Anyway, no more notice, except that ran out because he couldn't prescribe me anymore after a certain point. I coughed, could not drive, could hardly eat, and could hardly sleep for 6 months. And this one cough medicine was the only one that helped. So then I went through withdrawals for a day or two from the cough medicine. I had intense stomach pain, but it seems that my cough had finally gone away, as had my stepdad's. Fast forward a few months and I'm back at my family doctor for a checkup. And she says to me, I just read in this medical journal how whooping cough has been making a comeback. Apparently, the vaccine isn't effective for a lifetime. I think that's maybe what you had. Huh. Then in 2007, I'm off to travel during college break and need to update my tetanus shot. While I'm there, the nurse says, this also has whooping cough vaccine in it. New guidelines recommend a whooping cough vaccine every 10 years because it's not permanent protection, so they stick it in with your tetanus shot. And there you go. Patient 1, Doctor 0, but I'm also pretty sure that's rarely the case anyway. Let's go ahead and see what finds out in the next story. This is story 3. Most doctors don't have a problem with the Googling of symptoms. What we do have a problem with is when the patient gets hyper-focused on what they believe is the diagnosis and only wants to tell their story to the doctor and not answer the doctor's specific questions or, even worse, not listen to what the doctor's responses are. Prime example, I have a patient, 49 male, 6 foot, 205 pounds, PE teacher, ex-college basketball player, timeline 5 years, who presents with low back pain initially, thigh numbness and tingling, and about 3 to 6 months later, ankle-foot issues. The problems, I won't say pain, move around through the leg, then begin to have subsequent issues in the opposite leg. All along, the diagnosis was sciatica, with a possible degenerative disc or bulge disc or spinal stenosis. The patient was convinced it was something more serious, yet when I would refer him for further testing, MRI, X-ray, ultrasound, there was always a money issue. So the physical and chiropractic therapy I referred him to would give relief and he'd be symptom-free until the next time he did something to aggravate everything. After 3 years of this patient essentially wasting my time and not listening to what I was telling him, I finally lost my cool with this patient. I unloaded on him about how he was wasting my time, that he didn't listen to what the doctor was trying to tell him, and that I needed to fire him as a patient due to his compliance failure. When I finished speaking, he looked me in the eye and said, I've been having this neck pain. Do you think I need an MRI on it? I was incredulous. Some days, as a doctor, are filled with people just like this. As doctors, we dedicate our lives to bettering the lives of those in our communities. But we are all humans with the different personalities, fears, and pride that everyone else has. So, some advice, you are paying a doctor for his knowledge, and despite the fact that he might have seen this before, it's not his first time dealing with the common things people have. If you are adamant that your Google, Aunt Karen, or Gardner's diagnosis of your issue is the correct one, then find a doctor that you trust because you obviously don't trust the one you are talking to. Story 4. I'm not sure if this falls along the same lines as I am not a doctor and I don't necessarily Google my symptoms. I'm just a very unlucky accident-prone person, so I know a standard decent bit about what is where and what does what in the body, and I can proudly, infuriatingly announce that I have diagnosed my last 3 broken bones and my current problem, which is that I obliterated my ACL like I don't really have one anymore due to breaking my knee. I also caused an avulsion fracture when it happened, and that is the third broken bone I'm referring to. When I went into the emergency room after it had happened, I told them what I think. They gave me a knee brace and sent me home saying take ibuprofen and it will be better by Monday. It was not. And now, due to them criticizing my requests and statements every step of the way, I have been on a broken knee for over a month in excruciating pain because they don't do any pain medications. Certainly none that would help me, and I'm trying to get a doctor 300 miles away because he was the first person to actually listen to my concerns and had an MRI done. So now it's a race between the doctor's office for reconstructive ACL surgery and my insurance starting over in January because I can't afford the deductible for my really good insurance. Welcome to small town healthcare, where the people don't matter and a lack of other healthcare options makes it your problem. I honestly should have gone in and made the same joke to them as I did to my fiance right after it had happened. Story 5. I had a septate. Google it, it's hard to explain, but didn't know what it was called, and I just tried to tell the doctor I thought I had an extra piece of skin that wasn't supposed to be there. My doctor must have decided that I was just an insecure teen girl thinking there was something wrong with me. So she inspected and declared that I was a perfectly normal female and that there was nothing preventing me from using a tampon. So 2 months later, I tried to have physical relations for the first time, and that thing that didn't exist broke. In my panic Googling, I finally found what it's called, and it turns out that girls like me can get a tampon in, but will have to go to the ER when it expands and doesn't come out. When I finally saw my doctor so she could give me a referral to get the extra skin removed, I told her that I had a septate. I'd seen another doctor while she was on vacation to confirm this and that it had broken. She replied, "Well, I'm the doctor here, so I'll say what you have." But luckily in the end, she agreed that I was right, never addressing how I had come in months earlier and how she could have saved me all that stress and worry, but instead she gave advice that I'm extremely glad I didn't follow. I guess in this case, sometimes you do have to follow your own gut or things hanging off of your body that really aren't supposed to be there. But anyway, if a doctor had ever said that to me, I'm the doctor here, so I'll say what you have. I'm definitely getting a second opinion and for sure, at the very least, Googling it. But if you're turning to Google for medical advice, well, we've all done it. Where else can you see a simple headache become a brain tumor instantaneously? Anyway, if you're finding the content hilariously relatable, please do show me some love by smashing that like button and subscribing if you haven't already. Story 6. Not a doctor, nor was my brother, despite him thinking his Google foo is a degree, but a couple of years ago, my brother decided that since I had been laid off and needed to borrow some money from him to tide me over that, it meant that I was utterly depressed. Thus, he deduced that I needed to be institutionalized and took me to a doctor. He lied and said he wanted me to just get a normal checkup since I hadn't had one in a while. I was, I believe, rightly pissed off and embarrassed, but since I needed the money, I went along with it. So he decides to just come into the psychiatrist's office with me while she is trying to ask me some questions and see how I am. He starts throwing out terms like maladaptive coping and how much I needed treatment. She finally tells him to leave and I speak with her for a bit. Now, I was a bit morose because I had lost my job and was embarrassed about asking for help, but I wasn't depressed and the psychiatrist agreed, stating that I just needed support and not Google foo quackery. I hadn't turned to substances, stealing, or any other illegal or destructive activities to deal with my quote-unquote depression, just that I was a bit withdrawn and down because of my recent low. Story 7. My brother is both the doctor and the patient in my story. Around 2 months ago, he started to feel really tired and ill, like really ill. He had said to his partner that he felt like he had leukemia, which was, of course, just kind of shrugged off because why or how would he have leukemia? He had been suffering with a throat infection for a few weeks and was given antibiotics by a GP at his practice. After a week or so, it hadn't helped and he was tired and slightly breathless while walking the dog one Sunday afternoon. The next morning, he registered himself as a patient, took his own fluids after being prompted by his receptionist, parents, and doctor friend, and sent them for testing. Unfortunately, he had been completely correct, and when his results returned, he saw that he did have leukemia, acute myeloid leukemia to be precise. He saw the results and knew immediately. As he went to confirm them with the GP next door, the specialist hospital had already called and asked for the patient to be brought into the hospital immediately. Unfortunately, his hemoglobin levels and general cell count were so low, and he was in a really bad way. Many transfusions and one round of chemotherapy down, and he's determined to beat this terrible disease. There's a long way to go, but he won't give up, and neither will we. I love that guy so much, and I wish I could trade places with him. There's potential that I may be used as his bone marrow donor, and I hope I can be, because anything I can do to help, I want to do. It's not too likely to be me, but I feel so helpless right now, so it would be good to help, I guess. Anyways, no Google, but it turns out these doctor guys are pretty damn good at their jobs, even when it's certainly not their specialty. Story 8. I'm not a doctor, but my girlfriend was feeling a strong, sharp pain around her stomach in the middle of the night. I Googled it, and in my opinion, it was a kidney stone or something gynecological related. I wasn't sure of anything, but I had acquired enough knowledge to know that it might be bad, and we had to do something. So we went to the hospital. We waited hours and hours until we saw a doctor, and she asked her, "Can you rate your pain on a scale from 1 to 10? She responded 7, and then she looked at her for a second and said, while laughing a bit, "Well, no, your face doesn't look like a 7, and she left. Another doctor concluded it was just gastroenteritis and gave her some paracetamol after we had waited a full night at the hospital, and then we left. She was still in a lot of pain, maybe more. At this moment, I gave up. In my opinion, gastroenteritis shouldn't cause that much pain, but I trusted the doctor's diagnosis because, well, he is a doctor, and he had years of study and practice behind him, unlike us. But 2 days later, she passed a huge kidney stone while screaming at the top of her lungs. She had never felt so much pain in her life. Some say it's more painful than giving birth. We saw a lot of different doctors during the whole night, and no one listened to my suggestions. So, yeah, I get it. There are some annoying patients who wrongly self-diagnosed themselves and felt more educated than the doctor they are facing. But on the other side, there are also some crappy doctors who don't listen to their patients when they should. So I can understand that some people prefer to do their own research and don't fully trust their doctor. Well, if you're asking for my opinion, and I know you're not, but you're here anyway, so let me offer it to you. I don't think it's wrong or bad to do your own Googling. If anything, it gives you more context and more knowledge about what you might be going through. But then that's when we go to the doctor to get that specialist knowledge. And if our Googled knowledge doesn't match as well as we'd like with the doctor's decades worth of knowledge, then maybe it's time to get a second opinion. And that's all it is. Just get a second opinion. That's not Google, of course. Story 9. I'm not a doctor, but this is my story. When I was 19, I had severe stomach pains, and Google kept throwing up all sorts of things that could be wrong with me. One doctor took me seriously and would try to help me check for anything we or Google thought it could be. I was in and out frequently, but nothing serious could be wrong with me, they said. I was too young. According to the doctors, after 3 years of debilitating pain, I was told I was making it up. Oh, it's just IBD. I had tried cutting out everything, and this hadn't helped, and my symptoms didn't align with it. I could barely eat, and even drinks would come back up. I lived and breathed next to my sick bowl. It just became a part of my life. I finally got an ultrasound and 2 endoscopes. The first time they couldn't get down to the bottom of my stomach. I had to take so many tablets for the pain, 22 tablets a day. But they saw a tear in my stomach. The second one was scheduled earlier so I wouldn't have to deal with the pain for as long. I had 3 tears in my stomach, 2 were rather large. Suddenly, I was taken seriously. I had gastritis and was finally given the correct medication. Now, I don't have to take any, but do have to stay away from too much caffeine. If I have energy drinks, maybe 2 days in a row, I get pains. I can't drink frequently, but I never have anyway, and I have a pretty steady diet away from trigger foods. And I'm not meant to get too stressed. I hadn't had a flare-up in 5 years, though it's lasted longer than a couple of days. Story 10. My wife correctly diagnosed our daughter with a rare disease after 4 different doctors kept shrugging things off. She was running a high fever consistently for almost 2 weeks. We took her to the pediatrician 4 times, and each time they tested her for several different infections, and the tests kept coming back negative. They kept sending us home, saying it was probably just a virus. On day 14, we finally took her to the ER and demanded they do something about it. A virus shouldn't be this persistent. My wife had Googled all her symptoms: persistent fever, a rash that appeared pretty much everywhere, including her face, and red bumps on her tongue. She was just not herself, normally very active and hyper, lately just lazy and uninterested. And the best possibility was Kawasaki's disease. However, because this disease normally only affects Asian boys and not Caucasian girls, my wife really had to press them to treat her. The infectious disease specialist and pediatric cardiologist finally called a Kawasaki's disease specialist all the way out in California, discussed her symptoms and test results over the phone, and were told to treat her right away. She was admitted and given an IVIG. She slowly got better over the next 2 weeks after that. She did still have some kind of valve problem that appeared in her heart afterwards, but it luckily disappeared within a year. I'm grateful that someone finally listened to my wife and that she is as persistent as she is. All right, thanks for hanging out with us as we explore the highs and lows of Dr. Google. Now, before you click away, please remember to stick around for a little bit longer and catch just one more video. Doctors, what's the dumbest self-diagnosis you've heard from a patient? Story 3 is strange, to say the least. I'll see you there, and thank you for watching this one.